Good afternoon and welcome to the St. Clair County Emergency Management Agency Daily COVID Briefing. I'm joined with Director Herb Simmons. Samantha Bierman from the Health Department was unable to join us today. As she mentioned yesterday, the caseload is greatly increasing at the Health Department and they needed some additional assistance over there today. So we're going to go ahead and take care of reading the numbers here. In St. Clair County, they've tested 132,708, which is an increase of 1,446 since yesterday. For positive test results, they've received 11,427, which is 188 new from yesterday, and those are males and females under the age of 1 through their 90s, which gives us a daily county positivity of 13.0%. For negative tests, there's been 121,281. For deaths in St. Clair County, unfortunately, we are announcing 2 additional deaths today. That is a female in her 70s and a male in his 90s, both with unknown health conditions, and our thoughts go out to their families. For those that have completed their IDPH required 10-day isolation period, we're at 9,446. For state totals, they've tested 8,986,010. For positive tests, they've had 562,985, which is an increase of 11,028 since yesterday. And for state deaths, unfortunately, they added 166 additional deaths today, bringing the statewide death total to 10,670. For hospitalization numbers, here in St. Clair County, COVID-19 related patients is up to 87, and those on ventilators is 9. In our region, the regional COVID-19 hospitalization is up to 189 patients, with 21 of them on ventilators. For our congregate living facilities and outbreak status, we'll only announce the changes that we've had. Today, we have Cedar Ridge of Lebanon with 85 cases and 16 deaths, which is an increase of 1 case. And Mercy Rehab and Care Center in Swansea with 25 cases and 0 deaths, which is also an increase of 1 case. I'll turn it over to Director Simmons for his update.
We have some testing.
We do?
Yeah. Sure.
We're testing today at Belleville West High School from 8 to 4, offered by the Illinois Department of Public Health, and we'll be back there again tomorrow from 8 to 4, again at Belleville West High School.
And try to get tested. That's what we need.
Absolutely. Testing is very important. As these numbers keep rising, they're finding more and more cases that are out there.
Well, and Brian, at the one number, 166 new deaths, I think that's the highest.
That's the highest one-day death total, yes.
Sad. We'll talk about that here shortly. We'll go into the zip code report. 62201 goes up 2 to 330. 62203 goes up 6 to 333. 62204 goes up 4 to 200. 62205 goes up 2 to 292. 62206 goes up 3 to 594. 62207 goes up 1 to 322. 62208 goes up 12 to 660. 62220 goes up 13 to 829. 62221 goes up 18 to 1,055. 62223 goes up 16 to 728. 62225 goes up 2 to 61. 62226 goes up 10 to 1,220. 62232 goes up 2 to 312. 62239 goes up 6 to 169. 62243 goes up 7 to 218. 62254 goes up 9 to 377. 62255 goes up 1 to 24. 62258 goes up 16 to 370. 62260 goes up 3 to 266. 62264 goes up 1 to 131. 62269 goes up 26 to 1,034. 62285 goes up 11 to 230, and 62289 goes up 2 to 15. You heard Brian give the numbers report. Our daily county positivity rate is at 13%. The 7-day rolling is at 15.2. The surrounding counties in the region, Bond County came in today at 31.5, Clinton County 17.8, Madison County 15.3, Monroe County 32%, Randolph County 16.3, St. Clair came in at 11.9, Washington County came in at 18.5, and with all of those totals, our regional positivity as of November the 11th is 15.2, which is up from 14.8 yesterday. So Brian, again, it's the same old story. The numbers aren't getting better.
No,
The positivity rate for the region.
Positivity rate for the region is going up. We unfortunately expect that to continue by looking at what the daily numbers are. As you said, the regional positivity is on a 3-day delay, so we kind of have a little foresight into what's to be expected, and it's not getting any better. As we've talked about the last couple days, Chairman Kern announced the closure of the courthouse effective Monday, and we saw several other communities follow suit yesterday. City of Belleville, Mascoutah, Smithton, Waterloo, Columbia, Troy, Edwardsville, many communities here in Region 4 going, we've got to take a step back. We've got to take a minute, do a pause here, and see what we can do to help get this number down. We've already seen some major impacts at our businesses, and unfortunately, if this number doesn't get down, I think that those impacts are only going to become more severe.
Well, and I want to applaud those governmental agencies that are following suit, because we've been in this all together since day one now, 246 days. All of the mayors in the St. Clair County, we've kept them informed on every update, every step of the way. And for those of you who are taking the initiative to lead by an example, I want to thank each and every one of you, and I know Chairman Kern does also, because it's the right thing to do. To now's the time to everybody roll up the sleeves and start putting the foot on the brake to get these numbers down. If you look, another number that we've really been watching, under the age of 40. 95 of those cases today were under the age of 40.
And another day where we had cases under the age of 1. As Sam mentioned yesterday, those that are very susceptible because their immune systems aren't fully developed yet. But the important thing to remember that is somebody under 1 isn't knowingly going to a place they shouldn't or in contact with people they shouldn't. That is somebody else picking it up and bringing it to them, whether it be from a retail store, a restaurant, a bar, going to work. Those are all places that they're seeing these come back. And we're seeing that happen quite often, where once it gets into a household, it's taking the whole family.
Exactly. And, we talked a little bit before we went on the air today for the briefing. We listened, you and I both last night, to the update from St. Louis.
Yeah, Dr. Garza gave it, unfortunately, a very grim update. He said, our healthcare workers are exhausted. They're doing everything they can. And unfortunately, he said it's only about a couple more weeks to this. And everybody asks, well, how many beds do we have? How many ventilators do we have? That's not the big concern. Right now, the concern is staffing. The concern is how many nurses do we have? How many doctors do we have? How many respiratory therapists? Because these people themselves are exhausted. They've been working at this for 240 plus days. They've been doing everything they can to be there. And some of them have come down with the COVID virus. And unfortunately, I think we're going to see us run out of staffing before we run out of equipment.
Well, and I think as we talked, we've got to, and Team St. Clair, you can help get this message out there. Yes, it's the COVID pandemic, but when we talk about the hospitals being overloaded, there's a lot of questions that get posted on the page about, well, how many ventilators are there, how many beds are there. That is not just the only illness that our healthcare providers are dealing with. What if mom, what if grandpa, grandma has a heart attack, or they have some other medical condition, or one of the family members, immediate family, and they have to end up going to the hospital, and it's serious enough to where they have to be admitted. You have to make sure that these hospitals are prepared for all the other types of injuries our illnesses that are coming to.
And that was one of the things Dr. Garza spoke about on the conference call last night, is they are receiving an abundance of transfers from other rural areas that are just completely out of room. They're out of staff, they're out of beds, they are overrun, so they're moving them here to a larger metropolitan area. And they always want to do everything they can to help, but as they mentioned, they've had to turn some of those away. And he mentioned that there was patients getting referred to as far as Iowa just to get them a bed that had staff to treat them.
Well, and I don't know if any of Team St. Clair members or whoever was following that last night saw it, but you talk about a doctor who was getting emotionally upset just trying to get that report out, that update. I think that sends a message that all of our healthcare providers, everything from our EMS personnel who are responding to those calls, to the nurses in the emergency room, the doctors, the staff on the floors that are taking care of these patients. And as I said, not only these COVID patients, but just patients in general. We heard that another local hospital was actually sending out help request a day for staffing.
Yep.
Because, they have to be prepared. We're coming into that time of the year where other types of illnesses, the flu, whatever it may be, is going to be impacting these healthcare facilities. So we need to remember that. It's just not COVID patients. So when people are asking, well, how many beds do we have available? How many ventilators? First of all, we here at EMA don't have that information available.
Correct.
So when we respond to that, or when the staff responds and says we don't know, we're telling you we don't have that information. But we can tell you that it takes staff to make sure that those ventilators are operating properly.
You can have all the beds in the world, but it's no good for you if you don't have somebody to treat the patient that's in it.
Patient. So we wanted to just bring that up today, along with all the numbers, and we just ask for some compassion for those of you who go on our page here and make those comments. If we tell you we don't have those numbers, we don't. We're not going to manufacture them for you. We're going to tell you to the best of our ability what's been provided to us. People like Sam and Dee over at the health department, Barb Holt's staff over there, they're working around the clock. As Brian said, that's why Sam couldn't make it over today for the briefing. These numbers are increasing, 188 new cases in the last 24 hours here in the county. The contact tracers, to make sure that's getting done properly, it takes time to do that. They're wore out, everybody is. We know yous are wore out. You're wore out about hearing about it, but guess what? As we've said time and time again, we're all tired of it. 246 days we've been coming to you, giving you this information. We're tired of it. But the virus isn't tired of us, evidently, because it is still here. It took 2 more lives of county residents here. The most in the state, 166, I think it was, yep. New deaths in the state of Illinois. Those numbers are shocking. If that doesn't sink home to you, I don't know what does. We've got to pull together. We got to start putting the foot on the brake. New mitigations are probably right around the corner if these numbers don't go down.
Well, I think it's important to mention that those mitigations are on a 14-day window. Our window is expired.
Yes.
It is time for IDPH, and they are doing that reevaluation right now. But I think the question is going to be, is it just a tier 2, or do we need more mitigations? Do we need more than just that reduction of social gatherings to 10? And unfortunately, I think it's come to that point that IDPH is looking at this and going, we might have to impose more severe mitigations.
Well, and that's the thing. And of course, if we get that information, Team St. Clair will be one of the first to know, because we will post it up as we do with everything else that we get. Our community leaders will know. Again, I want to thank all of them who are taking the initiative to do their PSAs and get the message out to our business people out there. It's tough. We tell you that all the time. We're not going to pretend to walk in your shoes. You know what your financial situations are. We did have some people call today, some businesses. We've referred them to the Intergovernmental Grants Department. There are some funds that's been available. We've reported that now for several months. Some businesses have taken advantage of it through Mr. Stubblefield's office. But it's amazing. We hear about these businesses that are having these problems, but when you look at the request That's very few who is trying to take advantage of that. So we urge you that if you're a business out there that is trying to do the right thing, there is some help through the Intergovernmental Grants Department, and Mr. Stubblefield can help you through that. If you need that number, just we'll post it up on our page. And like I said, we want to try to make it as easy as possible. But again, the virus is here. It's going to be here for a while. There's a lot of the talk about the vaccine, but even if that was going to be here today, there's still a procedure, and it's going to be distributed to the frontline workers, the healthcare providers first. I saw the report last night on one of the news channels that, for the general public, it could be, the first quarter of next year.
Yeah, could be springtime.
Could be springtime. So, in the meantime, we got to keep doing what we're doing, but we got to get tested. You heard Brian say there's some testing available tomorrow at Belleville
West High
West.
School, yep.
And then we'll have a list of if there's going to be any mobile testing sites. You can always go to the Jackie Joyner Kersey Center, Walgreens in Cahokia, MedX in Swansea,
And CVS and Belleville.
CVS in Belleville. And we've talked about all of, some people get on here and say, well, why do we want to get tested? Well, we've explained that over and over and over. Do your own research if you want to. Sam and Brian and the doctors that's been on here has explained that why it's so important. Just because you're asymptomatic doesn't mean that you're not going to be carrying it.
Correct.
And with the holidays coming on, you're going to be hearing a lot more. But this next week with the Thanksgiving coming, you got to make some smart decisions on getting together, which is Thanksgiving is a lot of people's favorite holiday of the year. And you've made your changes.
Unfortunately, this year we had to make a decision that it's not a large family gathering. It's our own individual family just having a meal together, and we'll have a phone call or a little Zoom meeting with some of the other family members. But you just can't bring those big groups together right now because it places unnecessary risk. The last thing I would want to do is be asymptomatic, have the virus not knowingly, and then spread it on to my parents or, my young nieces and nephews, people that could even be more vulnerable.
Exactly. So we appreciate you joining us today. We'll be back tomorrow for day 247 for our question and answer and bring you some more numbers. We'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon. Have a good evening.
For more than 6 months, St. Clair County residents and businesses have been in the battle against COVID-19. As we see cases surging in the country and even close to home, we must again remind everyone the fight is not over. Team St. Clair has made it this far by following the guidance and direction of our public health professionals. Now is not the time to let our guard down. We must continue to wear a mask, watch our social distancing, and wash our hands. To get through this pandemic, we must work together.